Damn, it's been a while, huh? While Terran currently has a day job in local government public health as a trainer, they still are passionate about improving oral health for the community through their work with the Arizona Oral Health Coalition. It is my pleasure to announce my friend and our speaker for today, Terran. Thank you.
Thank you, Tammy, for that wonderful introduction. Yes, I'm really excited to be here talking a little bit about advocacy during our quarterly member meeting. Autumn, I saw that you hit record. Thank you so much. I know I got some requests and emails to record this meeting, so we'll be able to have that on our YouTube channel after this. And also, as we get started, I recommend that if you are joining us, please share in the chat, a little bit about yourself. Please share your name if you're with an organization, and go ahead and share where you're joining from today. I know we're virtual and we're from all over the state, so go ahead and pop in the chat. I can't see the chat most of the times, so if you do have any questions, Autumn will be able to see that and will let me know. But I'm excited to check out the chat later to see who's all joining. So let's go ahead and jump in. So as Tammy mentioned, I am the advocacy lead for the coalition. I've been in this role for, actually didn't count before. I think it's been a few years, but I've been participating with the Advocacy Committee since I believe about 2020. And so it has been a really great journey, learning so much about advocacy and seeing all the hard work that so many oral health advocates from across the state, do each year to support policy change that will impact oral health. And so I just wanted to take a moment today to talk about advocacy and provide some information and steps to help build you all up as advocates as well. So this training today is actually an adaptation from a training that we provide to students. So if you happen to know of any classes that are wanting a training about advocacy, let me know because we got it ready. Ooh, how do I go to the next slide, please? All right, there we go. And yeah, so I want to give a shout out first to the authors of this training. They are all listed here. We developed it a few years ago through collaboration and just everyone sharing their insights and expertise from all of their various experience in advocacy. And also a new part of this training is talking about our Coalition Advocacy Toolkit. And this was created early last year by the Coalition's Advocacy Committee, and all of the members who worked on this toolkit are listed here. So huge shout out to everyone who shared their knowledge, experiences, and input to create the first version of this toolkit. All right, so let's jump in. And I want to give a little bit of background first about the coalition. So our vision statement describes pretty much what we would define as a perfect world. And our vision statement is that everyone enjoys the benefits of good oral health as an integral part of overall health. So that is our most fundamental piece of our roadmap for what we do. And then our mission statement describes our purpose, and it underlies all of the activities that we undertake. So our mission is to be the catalyst for oral health policy and systems change that benefits all Arizonans, especially underserved communities, by uniting health advocates, community and state leadership, and like-minded organizations. And with those solid foundational pieces, we have our goals based on that. So generally, we aim to bring people together so that we can have a greater impact. And so our 3 goals are to provide unity and leadership for policy change and advocacy efforts, create networking and collaboration opportunities to maximize impact and reduce duplication of efforts. Today, right now, is one of those networking opportunities. And then our final goal is to provide oral health advocacy resources, information, and technical assistance to communities and professionals. Today as well is also an opportunity to provide those advocacy resources. And so the Advocacy Toolkit, like I said, this was created early last year. It is a really exciting development for the coalition. It is basically just a tool for you to help with your efforts for advocating for oral health in Arizona. It is especially relevant to Arizonans. It covers some of the quirks of the Arizona legislative process, and it's also especially tailored for oral health advocates. The examples in there are all focused on dental or oral health policies, but I do want to say that it still is helpful for other focuses as well. Just if you're having to be in another state, or if you're looking for another type of topic, I would double check with other resources just to make sure that you're getting some more direct information. And the toolkit has 3 main sections, which we're going to go over today, and that's the basic, how a bill becomes a law, and tools and tips. All right, so I have a few warm-up questions first for you all to put in the chat. And this first question is, do you know your state representative? Now, there's some new ones from the election last year. So I will accept either answer of if you knew a past one and maybe you don't have the new one up yet, or if you know your new one, go ahead and share in the chat. Let me pull it up so I can see it. I want to see it now. Ooh, might have some areas for learning. I'm not seeing any come in, but I know I'm putting you on the spot a little. But then how about our next question? Do you know how a bill becomes a law? You can share in the chat, maybe if you're a little bit familiar, pretty familiar. You could tell me right now, you could come teach the class. Let me know how familiar you are with how a bill becomes a law. Oh, Jen's got it. Oh yeah, Jen, I know you know. This is going to be review for you today. You helped make the toolkit. Awesome. Seeing some yeses. Oh, good. So glad to hear we have some active advocates today. But if you are not familiar or you need to know how to find your representatives, don't worry, we're going to cover that. All right, so we will jump in. I want to do some quick definitions first to separate a program from a policy. So policy is a general term that we use to describe any laws or regulations or rules or anything like that that govern and control the ways of doing things. This is in contrast to a program, which is a specific intervention, usually has a known start and end date and a specific health goal. So some examples of that include like the First Things First program or a kiddie clinic. Those are 2 different, very different scope programs. One of them is much larger and longer term, but they both are kind of more specific interventions. They have a start and end date compared to a policy, which is a law or a regulation that governs all kinds of things. And the types of factors that laws regulate include individuals. So individuals our behavior is subject to laws sometimes. So for example, tobacco usage in public is regulated. There are limits, thankfully. And then also laws regulate businesses and people participating in business. So some examples of this include scope of practice regulations for dental professionals and teledentistry regulations. So what things people are allowed to do and how a business can operate, those are all subject to law. And then laws also regulate state agencies. So the administration of access and how that is provided, what's covered, who's eligible, that is covered by laws and regulations, as well as the establishment of BODEC. That was established in law. And then BODECs themselves create several regulations. So those are some examples specific to oral health of policies. And if you know of any more off the top of your head, you are welcome to put them in the chat. These are some more examples as well from our friends, the Arizona Dental Hygienists Association, specifically looking at the dental hygienist scope of practice. So laws going back to 1970 that are changing how a hygienist can practice, the treatment options that they are able to do. And so just imagining how hygiene today would be different if these policy changes did not happen. All right. So throughout this presentation, I have an activity, just some more opportunities to hear from you. So one of the first steps in policymaking is called agenda setting. It's when the public and policymakers decide what is an important issue right now. So I encourage you all to think, brainstorm, and type in the chat, what are some issues that you see, some problems related to oral health that you feel are important, urgent, and impactful? So some examples that I have on here just to get the juices flowing includes scope of practice, maybe supervision, health literacy, Botox, that's a big one. Otherwise, general regulations, seeing areas of high need. There's all kinds of different issues that might be impacting the practice of dentistry or oral health in general. Give you some moments to type in there. All right, I see no access to oral health care for the adult underserved population. Yeah, that's a big problem right now. Yeah, thank you. And one that especially the coalition is very near and dear to us. It's a top priority for our policy change, is changing that access to oral health care for adults. Network adequacy, yes. Getting into the nitty gritty there, big issue. Yeah, please keep them coming and keep those in mind because we're gonna build on this in a few other steps as well. Maternal oral health, yeah, that's some issues affecting oral health that they're urgent right now. They're really impactful, and there might be some policy that we could advocate for to help impact these problems. Right. So I'm going to talk a little bit about our toolkit and look at section 1, which is the basic. So the 3 levels or 3 branches of government, we're pretty familiar with these thinking back to civics class, but basically our Constitution provides for a divided government that creates 3 separate branches that intends to keep one area of the government from becoming too powerful and unchecked. So these branches provide a check on one another to make sure that the government remains democratic. I do want to talk a little bit about what each branch does because we're going to be focusing mostly on one of them today. But because they all balance each other and interact with each other, it is important to have at least a high-level idea what each of them do. So this picture here is showing the federal government, but the state level government really reflects this closely. Just instead of the president, we have a governor. And so the executive branch, as I mentioned, has a governor and a cabinet, not quite in Arizona, but we can also include things like administrative bodies. They're sort of similar to an executive branch and a cabinet. The judicial branch is responsible for evaluating the laws and making sure that they are in line with the Constitution. Arizona does have a state Supreme Court as well as other courts. And the legislative branch is responsible for creating laws. And so in Arizona, we do have a bicameral legislative branch. So we have a House of Representatives and a Senate, which I believe is on my next slide, actually. Oop, get ahead of myself. There we are. And this legislative branch creates legislation, which are proposed laws, also called bills. And the Senate has 30 members. The majority party of the Senate will select the president of the Senate, and that is a key leadership role in the Senate. And then the House of Representatives has 60 members. And again, the majority party will select a Speaker of the House to fulfill those key leadership roles. Here's a picture of the Capitol complex. And you can see the governor building in the background there. The website for the Arizona State Legislature is azleg.gov. There's a lot of important information on there. It's a little hard to navigate. That might have to be an entirely separate training. All right, so activity step 2. So we're talking about those issues that we see. Let's brainstorm and think back to how laws regulate businesses, individuals, organizations. What might be some possible policy solutions that would address the issue that you put forward? So go ahead and brainstorm and type in the chat. But some examples of laws that the coalition has supported in the past to solve various oral health problems include supporting a bill that would expand the state Medicaid program called Access to include dental care for adults. So right now it's emergency only. And so expanding that might address issues such as access to care and the cost of care, things like that. So think about what types of laws and regulations might impact that problem that you mentioned earlier. Gotta get a little creative with this one. And sometimes laws might impact an oral health problem in an unexpected way. As I mentioned earlier, for some examples of laws include things like limiting tobacco usage in public. That will have an impact on oral health because, as we know, smoking is really detrimental to oral health. And so we can't necessarily make oral disease illegal. That wouldn't be an effective policy. But things to regulate, like how people use tobacco, can impact oral health. All right, is anyone going to be brave to share in the chat any possible policies, or maybe ones they've seen in the past? We could do that as well, that address oral health issues. Here we go. Access expanding. Who can apply fluoride varnish to increase pediatric integration? Yes. I think there's going to be a bill this year about that, in fact. And that, yeah, that's right. That would have a pretty big impact by increasing that integration, increasing who's getting fluoride varnish, and ultimately, hopefully, reducing cavities and improving health. Thank you so much. Yeah, expanding access for pregnant persons. Oh yeah, absolutely. The big one. You'd see it pretty direct, seeing that expanding access to care, hopefully expand utilization of care, improve health. Absolutely. Ooh, toothbrush sanitizing. What's that? I'm curious. What does that mean? I'm not familiar. Luann, are you able to say more? And you're welcome to unmute too, if that is easier. All right, I'm going to circle back to that one. I'm really interested in learning more about toothbrush sanitizing. All right, so I'm going to show now about section 2 for the toolkit. So this is a relatively large section. It's about how a bill becomes a law and what you can do. And so the definition of advocacy is really any action that speaks in favor of a cause or supports a cause or pleads on behalf of others. And this includes educating lawmakers and the community about public health or oral health. Sorry, I'm still in work mode. Oral health issues and possible solutions. So that is basically, the high level of what we want to do. And how do we want to do it? Well, lobbying is a type of this. I do want to acknowledge this first. So you might hear the terms advocacy and lobbying used interchangeably, but there actually is a difference. And a lot of what we do with the coalition is advocacy. We do some lobbying, but advocacy includes things like developing fact sheets, educating the community like this webinar right now, and talking to lawmakers about the issues that we see and how it is important to us. Now, lobbying is a specific type of advocacy, and there are 3 measures to know if you're lobbying. And it's if you are talking with a lawmaker, that's the first one, about a specific piece of legislation, that's the second piece, and asking them to take a specific action on that legislation. So if you're talking to a lawmaker and asking them to support a bill, that is considered lobbying. That's considered direct lobbying. There's also grassroots lobbying, which is basically asking other people to direct lobby. Is communicating with the public to ask them to talk to their lawmaker and make a recommendation about a specific piece of legislation. So when we send out an action alert as a coalition saying, hey, please talk to your lawmaker and ask them to support this bill, the coalition is engaging in grassroots lobbying. And this can be a really impactful type of advocacy because it provides information specifically about the actions we want to see, but it's not the only type of advocacy. So just providing that information about the oral health issues that we see can also inspire action from lawmakers. Okay. And so the toolkit goes step by step with the Arizona legislative process. And I have here the video. I'm sure you know what's coming. I'm going to check the time actually, because I don't know. We might skip this video for now for homework. Is anyone going to be really bummed if we don't watch Schoolhouse Rock? I'm just a Bill. Or possibly, do I hear a sigh of relief? I'll send it out. I'll send it out for homework. And when you check out the toolkit, which I'm actually going to share in the chat as well, pages 8, 9, and 10 review the steps of the Arizona legislative process. It's not the most fine of details, especially when you get to the committee of a whole bit. That's a little too much in depth, but it does go through the steps from introducing a bill all the way to a governor hopefully signing the bill. And it also includes things that can be effective advocacy at each step. So for example, I have here, this is page 1, the first few steps. Introducing a bill. Things you could do at this step include marking your personal stance in the request to speak system, which we're going to talk about in a moment, and proactively meeting with key figures and committee members. So those leadership for each house and maybe committee leaders, you might want to start meeting with them so that when the bill does reach them, they're familiar with it. And so each step has an overview of what happens and those steps that you can take. And I know there's a lot in the toolkit. We tried very hard to make sure that it is approachable and high level enough while still providing enough detail. And I recognize it can still be a little overwhelming, especially if you're not familiar with it. And so that's why the coalition sends out action alerts to help remind you of some of these key steps. So it's January now. This is going to be starting soon. If you're subscribed to our newsletter, you're going to see some action alerts come across your inbox when oral health bills reach some of these key steps, and we need your support to make sure that the bill progresses. All right, so our step 3 is building on our previous steps. So we talked about a problem and some potential policies. And now getting your bill signed, it can be challenging. There's a lot of steps that need to happen. So I encourage you all to type in the chat ways that you have advocated in the past for oral health policy, or ways that you see yourself advocating in the future. Maybe you want to meet with lawmakers and talk to them about the issues that you're seeing and how it's impactful for Arizonans. If you're familiar with the request to speak system, which I keep teasing, we're going to talk about it in a moment, maybe you sign into the system and mark your support. Maybe you want to build the base a little bit more and talk to your friends about this issue and encourage them to talk to lawmakers. Oh, thank you, Autumn. We got Capital Day. Yes, that is a great way. And many people in the past few years have participated in this. It's so fantastic to see all of the advocates join us at the Capitol to talk about oral health. Yeah, thank you. What else? What else have you seen for advocacy strategies? And if you need any inspiration, I definitely recommend checking out the toolkit. We got all kinds of recommendations for things you can do at each step. And we'll give a couple more seconds to see if anything comes in the chat. I need like some Jeopardy music. I'll make a note for next time. All right. Yeah, definitely check out our toolkit. It has all kinds of helpful information about advocacy strategies. All right, including this next section. So tools and tips for individuals. This includes a lot of templates and more specific guidance on how to do some of those advocacy strategies. Pages 13 through 19 is the section 3. So if you're taking a look at it, it has all of these tools listed on here. So we have a step-by-step guide for finding your lawmaker, finding out which district you're in and identifying which lawmakers are your representatives. Talk about the request to speak system. Here we are finally. So the request to speak system, it's an online system that lets you both track where bills are, and it also lets you register a stance on those bills as someone who lives in Arizona and wants to have a say on the laws that are being considered. And so anyone can make an account online, and the link is in the toolkit. However, if you want to participate and speak during a committee meeting, you do have to, I think they call it like activate or validate your account. I don't remember the exact term, at the Capitol, or I believe there's a location in Tucson as well. And so if you create an account and need help getting it activated, validated, sorry, I don't remember the term, please let us know, because someone else can help and go to the Capitol and validate it for you. It also does have a very helpful section for tracking exactly where a bill is. You don't need to go to the Capitol to use that section of it. And so it is really nifty if you need to know like when a committee is hearing it or things like that. Another tool is a step-by-step guide for creating your message. So if you're going to speak to a lawmaker, or you're, I don't know, writing a blog post or something, it has some guidance for crafting that message. Also some tips for what to do and maybe what not to do when meeting with your legislator. And we have some links to other organizations and some advocacy resources from other organizations as well at the end. So yeah, I highly encourage you all to take a peek and flip through that toolkit, see if anything could be helpful to you. All right, section 4, there's not a section 4 of the toolkit technically. So it's more section 4 of this presentation that the work continues. With advocacy is an ongoing but vital process. And we do want to recognize that success can be hard to define with advocacy. A lot of changes that we see are small and incremental, and it really takes a lot of persistence to see changes. We face a lot of opposition, a lot of obstacles. That is a almost always existent part of advocacy. But we really want to say, don't give up. Don't let people decide things for you. They're not going to wait, they're not going to invite you. They're not always going to ask like, hey, what do you think? You have to make a space at the table. But it is so important to do so. And it also doesn't have to be difficult to do that. Participation in advocacy, it can be simple. You don't need a lot of time. You don't need a lot of expertise. You just need some passion and some preparation. And so we're hoping that this toolkit and participation in the coalition more broadly can help provide that participation and that support. Yes, without advocacy, the bottom line is that change does not happen. So we have to make it happen. All right. Coming to the end of all that I have to present. And so I would just like to ask you all both to share, something, reflecting on what we've talked about today. What is a helpful or interesting thing that came up for you during this presentation? Since we're at a good time, you are welcome to share it in the chat, or if you'd prefer to unmute, please do so. Perhaps consider raising your hand. I can't see on the other end because I'm sharing my screen, but that will probably help with managing participants. Yeah, what's something that came up for you during this presentation? I'd love to see it.
Karen, we have a question from Lori, and she wants to know what the ADHA agenda is for 2025.
Ooh, good question. I admit I haven't been as up to date on my emails in the last few days, but I don't know if I've seen it emailed out. To double check that, Lori. That's a good question. Oh, I don't know if I froze or if Autumn froze. Okay. It might have been Autumn.
Well, I know the one thing that's happening with the ADHA is, Lori, is the fact that, and I'll put but I'm sorry, the ADHA is working for, one of the things that's coming up is the Hygiene Ambassador Program, and that's something they're gonna be pushing for, one of the things, but that is just to get the increase in workforce. So that's all I've heard about it.
Thanks, Tammy.
Welcome, friend.
Yeah, any other questions or comments? Reflection, discussion?
Well, let's talk about something really that's gonna start happening pretty soon, and then how we're gonna face it as dental professionals. And what if they take Florida away from us? Are we gonna start trying to push and advocate for some of the policy changes? What are we gonna do? Are we gonna get on the ground? Yeah, let's see what everybody has to say about that stuff.
That's a good example because that is a really good city level policy. So water fluoridation is controlled at the city level because it's the city water supply. And so not every city in Arizona has fluoridated water. In fact, a few of them have specifically decided to not. And some of them actually have we just learned this the other day, some of them actually have a naturally high level of fluoride and they don't need to fluoridate it at all. But I know a lot of Phoenix metro cities do fluoridate their water. And so if that comes up, we're going to see that at the city council level.
Darren, I've been trying to get first things first educated on this and to try to see this coming because I don't think they understand the seriousness of it.
Mm. Yeah, I totally hear you with trying to be like proactive about it because it's so important and it's so efficient. I don't know if that's the right word, but how impactful it is for comparatively a smaller amount of effort. So I'm glad to hear that you've been talking about that with first things first. I know we've talked about it during one advocacy committee meeting, and we just sent out actually some feelers yesterday over email. And so, Lori, I'd love to follow up with you to see if there's anything that we could do to support that. Things like we could help with providing any information or data or just support or anything you need.
Yeah, I've been sending over some really good science based evidence research over there. Dimensions just had a really good article that just came through. So I sent them that. And and I follow a med page, sent them that. So I don't think they understand that how significant that threat is.
Mm-hmm.
But I'll let you know if there's something I need.
Okay.
Well, I work in the clinics, and I had there's a few parents, like when it first was, the election was over, we're talking about you're not even wanting fluoride varnish, and these are kids with enormous amount of decay. So what's going to be the next one that they're going to attack? Is it going to be silver dining or something like that? So remembering that, hey, we use a lot of that in our public health. And the people that are going to be the most challenged are the ones that usually don't get. So I think that's a big advocacy that we need to, be aware of. See something, say something kind of thing when it comes to the advocacy world.
Yeah, the kind of public awareness and public sentiment about it has been changing lately. I definitely agree with you there, Tammy. And it's interesting because it feeds into policy change as well. Like how we talked about earlier, that agenda setting phase where it's not like one formal conversation, but the conversations all add up between the public and the lawmakers to decide, what's important right now. And if there's some anti-fluoride conversations going on, that will impact the policy. So what can we do to get into that conversation? It's a good question. Do we need to start talking to the city council? Do we need to start doing any other interventions? I'm really curious if there's any other organizations doing work right now. So excited to hear what our feelers feel for those emails yesterday.
Yeah, I agree. That's going to be a huge thing, just moving down. But it's always going to be the people that are the less fortunate that are going to be the ones that suffer. And we just got to keep pushing it. And I think coming together with organizations like whether it's the ADA, the ADHA, the public dentist, Association of Dental and Medicine for Special Needs. That one, because that's a huge thing that's used in the special needs departments are the SDF and the fluoride varnish. So I don't know. I'm gonna be calling on everybody on this call to advocate.
I see Jen's question. Is there any plan for the coalition to be proactive and educate city officials? There's not a specific plan yet, but we are asking around to see what people, if there's anyone doing something that we can support. We don't want to duplicate those efforts. And so we'd rather, join in with an existing strategy and group. But if there's not, what does that look like? Can we be proactive and start educating city officials? Do we want to take that on as a priority? It does sound very important. So if you are interested in helping answer that question and how we are working on that, Jen, you're already in the advocacy committee, but I encourage anyone else in this call, if you or your organizations are wanting to, do something about this and be proactive in preventing any limitations to water fluoridation, I highly encourage you to join the advocacy committee. Please just send me an email. The newest invites for 2025 haven't gone out yet, but there's going to be a few different types of meetings. So you will see that in the newsletter tomorrow, and just let me know and I can add you to that. Yeah, this is, like we're saying, fluoride is such an important way to protect oral health, especially for people who are experiencing oral health disparities. So we want to include that in our advocacy effort. Good question. Any other questions, comments? I'd also really like to hear, that's what my next slide is. I don't know if I have, oh, this is my last slide, okay. If anyone has any suggestions for things to include in a new version of the toolkit. So if you're looking through the toolkit and you're thinking that something else might be a helpful tool, or maybe you have something that you'd like to add to the toolkit, please let me know. This is a document that we want to continue editing and adding to. So if there's something that you would like to see, please share in the chat or unmute, or you can email me if you think of something later. And same for if you have something, please let me know. Collaborative effort. Or maybe it's pretty good already. It's all the work of the advocacy committee. Oh, hey Jen.
I'll try and find some language about how folks follow their city council members. And because that varies from city to city. And then also this morning, I looked at the process to talk to Board of Supervisors.
Yeah.
That's a little old school, but there's a process. But just to get people thinking that there is federal, there's state, and there's ways to advocate to your city council folks. And sometimes they're really easy to get to.
That'd be wonderful. Yeah, it is really focused on state right now. So I would love to see it expand to include more city and local. Great idea.
Yeah, I do that.
It reminds me, sort of unrelated, but slightly related. I totally recommend that you sign up for your city council person's newsletter wherever you're at. Their newsletters are popping, or at least the council member that and I'm in her district. A lot of great community event news, and like they send out surveys all the time about like parks and like improving sidewalks and stuff like that. So just a random highlight there. Totally sign up for your city council members newsletter.
So are most of the city councils in the state pretty active, same size? I know obviously Maricopa County is huge. They have a big city council. I don't know, Jen, if you know like about Flagstaffs or Bisbees or how many there is, and maybe that could be, if we're gonna do education, you know, obviously most of us are in Maricopa County, but it's, again, this is a statewide thing, so maybe it would be a good idea to find out about other cities.
Very, they're all varying degrees of active. Maricopa County alone is home to 17 cities and towns, I think, 17. And then across the state, it does vary. We could probably look at the League of Cities and Towns to get a list of how you connect with everybody.
We're
Because
gonna
it,
get down into the fluoride weeds, you know, that's a huge thing, and there is lists that the state has, ADHS has, you know, who fluoridates what, how much, all that kind of stuff. So that information is available through ADHS. But, you know, if we're talking about a statewide campaign for fluoride, or by county, or just maybe a little organization coordinated, you know, within the state might help.
yeah, I mean, in some places, water could be driven by county and not state, not city.
Right.
And it all depends on the water, where the water's coming from.
And all that's written down, but again, if we just want to focus on Phoenix, or if we want to focus on the cities in Maricopa County, that would probably be a pretty big bite of the elephant. But again, I think things to have in our toolkit might be creating messages or creating what would you call it? Propaganda. No, I'm just kidding. For, you know, that anybody in the coalition or and the advocacy committee could reach and get without having to reinvent the wheel for all the different. I mean, it probably wouldn't take that long.
Yeah, for some of those, okay, for some of those top oral health issues that we see again and again, it could be good to have some kind of template messaging, like you're saying, Jan. That would be helpful to include in the toolkit. Absolutely. I am going to stop sharing my screen just so I can get back to seeing everyone.
I have one more question. I'm sorry.
Sure.
Slow motion here. Phrase it right. The list, I think that Autumn sent us about the different issues. There was an email. And we're supposed to comment on that by next Friday.
Mhm.
But as I was looking at that, I was wondering if an exercise in with this group, a prioritization might be helpful for the coalition as a whole. I know these maybe were our top 5, but it's still a lot of work. If you just look at, you know, if we're going to work on those 5 things, it's a lot of work. So rather than just working on all of them, or, you know, pick one, do one at a time? I don't know, maybe that's not right thinking, but
Yeah, I see what you're saying. And just for a little bit more context, it's not like a secret for anyone in this meeting, so I'll describe it. But we sent out an email yesterday asking for some feedback on topics for our annual conference. So don't worry, Jan, those aren't things we're taking on as like priorities for advocacy. Well, I mean, they're not, but they're not our work plan. They're just some ideas for topics for our conference that's going to be happening in May. Little teaser for everyone. We do our annual virtual conference every year. And so we're just thinking of some ideas for some hot topics going on right now. And Jan, with your connections to Open, we wanted to get your feedback. And open invitation for anyone else in this call. If you have any hot topics, things going on that you might like to see brought up as a topic during our annual conference it's a virtual conference in May, please just send us an email or put it in the chat.
I guess what I would like to see is not an initial discussion about these topics, but a current, you know, like what, like, let's not start talking about water fluoridation in May, because I think a lot's gonna happen between now and then, so maybe more, there might be something that for the annual conference topic wise where you could have somebody speak or whatever. But I think updating everybody on Arizona and or the world might be part of that annual conference. Suggestion.
Yeah, thank you. I think it'd be great to have some updates on those topics. 'Cause yeah, I agree. It's by May, we shouldn't just be starting these conversations. More about an update and progress and things coming up in the future.
And also for this group, Jen knows, but Open is having a live in-person Hill Day, May 13th and 14th, around in there. So I don't know when, what the date is for our annual conference, but I think there's going to be a lot of information about what's going on with, you know, HHS, with whoever's the new guy with fluoridation on that level. We might not even, you know, need to talk about it if they take it away from everybody. I'm just, you know, throw that out there. But yeah, that's, you know, I love Open, but it's always been the kind of thing I come away from meetings like, and they might be a good meeting, and then that's that. You know, there's no follow-up, there's no continuity. So my big hope is that this year with the new, whatever you want to call it, the new ideas, the new folks, that there's going to be more concentration, more follow-up on stuff that happens, and they're not one-offs. And I hope that for this coalition too. So it's building forward, building, you know, getting new partners, you know, all the stuff that's important.
Oh yeah. And we can relate to that for the coalition as well. You know, there's always,
that's exactly why I'm saying it.
yeah.
You know, so and I think part of the reason with any coalition is turnover. You know, people on committees. I mean, there's been people on the Advocacy Committee now that have been there for years, and or that have been around for years, and you know, AZOHC and that link and all that, but we need to hang on to that stuff, you know, and push again going forward. It's all-
Right. Yeah, thank you. Does anyone else have any other questions about the toolkit or the presentation or suggestions for the toolkit? I know we're coming close on time, so I want to make sure that I get those questions answered. All right. Please do email me if something comes up.
I have a
But thank
question.
you.
Who's
Oh,
getting,
sure.
where is this been distributed?
We emailed it out to our partners when it was first published, and it's also been in the newsletter. And it is on our website. I think right now it's our spotlight on the homepage on the hero image, and it is available in our advocacy resources on our website. Yes, good question.
So how do we get
And
it?
now we talked about it today, so this also includes a opportunity
How do
to
we
share
get
it.
it to people? How do we get it to people and organizations that aren't already involved with the coalition that we might want involved? So how it might be a good foot in the door,
Yeah,
especially since sessions just starting up. You
a
know,
good
like
question. Let's talk about that during our next advocacy committee meeting. Get some strategies going. I like how you're thinking, Jan. You're like, what next? What next? That's an important mindset.
it's been a morning, but I think I'm finally. It's like when you get old, sometimes you just don't sleep. Woke up at 2:30 and it was like blah.
Oh my gosh. Well, thank you. I appreciate you being able to join, Jan. And thank you all so much for everyone who was able to join and for your feedback and questions. I'll hand it back over to Tammy to wrap us up.
You're on mute.
That's the first time I heard you because you weren't talking loud enough. Just kidding. So everybody have a wonderful day, a wonderful weekend. Thank you for attending this webinar here with us and our members meeting, and look forward to seeing you on the next happy hour. Have a great day and take care. Bye. Gotta go back, clean teeth.
Thanks, everyone. See ya.